Welcome to SMA's Southern Medicine Podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine Podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population.
Hello, everyone. This is Philip Hartman, family doctor and president of the Southern Medical Association, and I am bringing you part 2 of the Fireside chats with troops on the front line of the COVID-19 epidemic. Today, I have with me Mike Foster to discuss treatment of addiction and maintaining sobriety during a time of pandemic and isolation. Before we begin today, I want to encourage all of you to go to sma.org/podcasts to subscribe to this and our other SMA podcasts. Mike was born and raised in El Paso, Texas, where he grew up in an exciting life of racing motorcycles and drumming in bands. And though many positive adventures came out of his lifestyle, addiction became a true reality in his early 20s. It wasn't until the age of 32 that Mike's world came crashing down, and he had to face that drugs and alcohol were in complete control of his life. After a successful stay at La Hacienda Drug and Alcohol Treatment Center, Mike was ready to start a brand new life in sobriety. Through dedication, change, self-forgiveness, honesty, focus on purpose, and a committed life to Christ and serving others, Mike remains living a life free from addiction. Over the past 7 years, he has obtained his credentials as a licensed chemical dependency counselor, internationally certified addiction peer recovery coach, internationally certified alcohol and drug addiction counselor, recovery coach training facilitator for ICAADA, and a certified nurturing parenting facilitator. Today, Mike lives in Northern Kentucky, happily married to his wife with 5 children and 5 English bulldogs. Mike, thanks so much for coming on here to talk to us today. First of all, to set the stage for our audience, you are a certified recovery coach. Can you tell us what a certified recovery coach is?
Absolutely. And first off, I'd like to say thanks for having me on here, and I'm excited to talk about this topic, as I know it's on a lot of people's minds. So as a certified peer recovery coach, the short answer is basically I'm almost like a resource broker. I provide linkage to recovery community, treatment, and other supports for people struggling or, looking for a life of sobriety, help be that middleman for them. Recovery coaches are not sponsors like in AA, where they work the 12 steps, and peer recovery coaches are not counselors, where they will work with you, in treatment centers and other areas. But recovery coaches is a person who helps remove and tries to help remove personal and environmental obstacles to recovery and link the newly recovery person to the community. This may be a paid or volunteer service, but with it kind of being a new area to society, us certified recovery coaches really like to push that work with a recovery coach who just doesn't claim to be one. Make sure that they have the proper credentials and certifications.
Now, I read off the list of credentials and certifications that you hold. Would you mind telling our listeners what sort of education and training went into obtaining those?
Absolutely. For my licensed chemical dependency counselor one, the LCDC, that's kind of a higher one. So, you would have that for that particular one. It's my counseling credential. So that's 4 years of school, going through an internship, to obtain all the hours. That took me about, 2 years, and, different things like that. For recovery coach, you don't have to go to a 4-year school. You actually don't have to have any college education. You can have your high school diploma. But like we do at ICATA, which is in Indianapolis, there is education that you have to go through. There's a 5-day course that's all day long, 5 days straight. There is ethics training that you have to go to, and also about HIV training and whatnot. And then there is, they do want you to get your hours, about 500 hours in your practicum to get the experience. So though it's not as long, they are, and much more states are asking and making it mandatory that people have this type of education, but it is much easier and quicker to obtain.
Wow. Well, it really sounds like the 4 years of training, the internship, 500 hours of practicum experience, plus your life experience that you bring to the table, all make you the perfect person for my next question. What has this pandemic changed for those in recovery?
The biggest thing is the isolation. And as you know, when we're talking to somebody who is looking to make a behavioral change, we want them to not do it by themselves. We don't want them to go at it by themselves or be in a state of isolation. Yet this pandemic has created that exact problem. People are feeling alone. People don't really know who or where to go, and so they are left with themselves. If one is not properly set up with the right resources and materials, this can be a scary thing. So, the biggest change for this is, so many of us in recovery are so used to, oh yeah, we go to our meetings, we meet up with all these people, or, we go to church and we meet up with all these people. Usually all these things that we have in our life involve many other people. Well, now we got to find ways to do it by ourselves. But as we'll talk a little bit further, there are plenty of ways to do this not alone, even with this order set in place.
Well, that's definitely good to hear that there are some solutions there. As a family doctor who treats drug and alcohol abuse, I've been extra nervous about my patients in recovery through this. And while I would love to say I can wave a magic wand and pull my patients in recovery out of isolation because sobriety is essential, I can't. What can I do as a provider? What resources can I give my patients and help them keep their sobriety through this?
It's a great question. It's in so many states are different, but so the quick answer of that is we have to get connected with an online community. There are many of these resources popping up right now, and different organizations kind of quickly thinking on, okay, how can we do this? Online meetings is a big deal right now with Zoom and so many others. It's been able to provide that resource of, look, we can't be face to face, but we can still at least see our faces or hear our voices. As for a provider, encouraging them and to go do this, for them to look up what resources they have that they can get online, Facebook or many different things. And then as that provider, when you talk to them again, ask them, hey, what did you find? So we have this bit of follow-up to see what they did. Look, did they make the effort of looking for an online meeting? So many times I'll work with the people that I work with, and they'll say, well, Mike, there just isn't that. There isn't that in my community. It's not like yours. And then I just kind of turn to them and put it back on them and say, wow, well, what a great opportunity for you to start something. So now you're able to get involved. And, with, like I had said before, through service work, it's a new way for us to serve. That helps keep the focus.
What a great way to empower your patients. Now, you mentioned the online communities. I know my medical practice has turned largely to video visits through this time. And I know this has also changed all of our social lives dramatically. How has it changed the approach that you take to connecting with your patients as a recovery coach?
Fortunately for myself, I had just from seeing where our life is going, right? So many people are going to iPhones and the computer and online deals. So I had started early on and actually got started as being a recovery coach through working with somebody who could not see me face to face. They were actually out on tour. I believe it was out in Iceland, and they still wanted to have that person to talk to. So we started off by doing a lot of phone meetings. So with all of this going on, it's really, you know, changed us to the point to where, okay, if I'm working with somebody local, yes, we would meet up somewhere. We would be able to have that community together. But now it is just saying, okay, let's set up a Zoom meeting. You know, if you don't have Zoom, okay, let's do FaceTime. All right, you don't have that. Can we at least text? Okay, if you don't have that, can we at least talk? So it's getting creative and then setting up those accounts. The nice deal is that there's many free options to do this. Again, once I think people really start searching this, they will find those options.
That's great. That's great that, one, you had the background in it, and two, like you mentioned, many of these options are free. So say we do get to reach one of our patients who has an addiction issue during this time. What sorts of tips do you have that we can give them as far as their struggle for desire to use during quarantine?
So, you know, first off, again, going to the isolation, we kind of get locked in our own heads. And so many people battling with addiction, this is something that is really kind of what drives it, is they're lost in their own head. They have some negative, you know, negative things that they keep repeating to themselves or saying over and over again, or just this kind of no hope thing. So, you know, what we can do during this is start working on our own individual mindset and direction. You know, we can't control what's happening, but we can do something about ourselves. And so many people go, well, you know, this is happening, so I can't do this. Well, this is happening and I can't do that. Okay, well, great. We've, as a society, we're pretty good at recognizing what we cannot do or what is not readily available to us, but we can work on ourselves, recognizing that this is boredom. We are bored right now. We are sitting in our homes. There's not a whole lot to do. We have to get creative. Our mindset is such a big part of this. This can really help, you know, change that negative behavior and negative attitude. So we must change the mindset and behavior in order to succeed. Simple ideas are, you know, we don't have to make this hard. We don't have to make this big. Simply go for a walk. You know, start doing some body weight exercises around the house. You know, again, phone a friend, you know, start and finish those projects that you have around the house, you know, right. There's so many simple things that we can do and that you do have options. That's the bit of hope in this, is you do have options.
Absolutely. And it sounds like those are some great ones you've identified. Now, as far as providing a positive message, since I know that a lot of the drive to use through this comes from that feeling of being alone. It comes through that feeling of boredom. It comes from that feeling that nothing's going to get better. Is there a way you can reword this quarantine that might provide it in a positive light for patients suffering from addiction?
This is your chance to kind of rewrite, or I'm sorry, you know, well, yeah, rewrite your normal routine. You know, it is major change, and what we want to see as a recovery coach, when I'm working with somebody, I need to see that change. I need to see the routine broken. I need to see something change in their life to send them down a different direction. I think people recognizing that, wait a minute, this is my chance to be free from my normal routine, you know, and my negative behaviors, and start a new way of living. I mean, we've been given a chance to actually change. And on top of that, have the days and weeks and time needed to start putting change into effect in order to form a new desired outcome or a new behavior. So in so many interesting ways, though this is a scary deal because of the isolation that we don't want to see, it's also been a nice little wrapped package for us. By trying to look at this in a positive way, it's a nice little wrapped package for us to say, okay, I am distancing you from the areas that you go to, you know, bar, seeing your drug dealer, or, you know, insert where you go here. I'm freeing you from that. I'm kind of stopping you from doing that or being around the people that you are influenced by, and giving you this opportunity to now start on your own, just like almost at a treatment center or somewhere where they help you isolate from those things and starting a new way of living. This is where, somebody may say, okay, well, what if I live with the person? Or what if, I get it. This is not as easy as just like, oh yeah, we're going to, simply change and do something different today. I get it. But we have to start looking somewhere. If you do have those areas where it is in-home the deal, this is where I say, okay, great. Maybe you need to talk to your doctor, talk to your physician, talk to a counselor, talk to somebody that can help you with those types of things and move forward. As a recovery coach, kind of just staying in my lane, it's, hey, turn this around, look at this in a positive way. And the way that you get to do that is you have been given a very nice chance to change your behavior, change your normal routine. And now you have the time and days to do that so that it can turn into a new habit. Super important to give yourself that time. And well, basically, we've been given it for, we'll see how long this goes.
I really like that spin you just put on it, that while we can all name 100 negative things that might lead somebody to use during this epidemic, if they've got the propensity to do so, this also provides a forced friction to change your day-to-day routine, that none of us are allowed to maintain our routine exactly as it was before. And that's always an opportunity to make it a safer, healthier, better routine.
Absolutely.
We talked about, you mentioned when you're stuck inside your head. And I know that a lot of sobriety involves believing in your own individual value as a person, believing that you are worth being helped, believing that you're worth getting sober. Now, I know through this, a lot of people have linked their identities, for better or for worse, to what they do for work and what they do in their social life. So a big part of their identity might be the job they do or the people that they see that they help in their regular routine. Is there anything you suggest specifically for an addict who really feels the need to escape his head and is looking at drugs to do that through this isolation and this overwhelming worry? Anything that a person who truly feels alone in all of this might be able to do to feel that value and to feel less alone?
Yes, and it's something that was big for, that I attribute to my success in sobriety is service work. And being able to, again, get kind of creative here on finding new ways to do that service work, to volunteer, to help a neighbor, to do different things. Now kind of work with me on this example, if you will, for a little bit. But something that I saw funny is that that I kind of was like, you know what, there you go. Maybe all of us could find our new creative ways to do this. But I was watching the news and they had on this deal how a neighbor was using their remote control car to drive a beer over to their neighbor. I thought it was hilarious. And I was not about to sit there and go, oh, that's a horrible behavior. We're, giving a beer. No. Let's look at this at a positive way. Alcohol is not bad for everybody. There's people who can enjoy those types of things. I myself am not one of those. And if I know somebody in my community that is like that too, maybe I could use my son's remote control car to kind of serve him and send him little things or little messages or something that would be a positive little smile in their face. I mean, I'm sorry, you cannot help but laugh if you see a remote control car coming from one side of the neighborhood over to you just to deliver you something, I don't know, a cupcake, a message. It does not have to be hard. It could be super silly just to get ourselves out of that, kind of we're stuck in our house deal. But yes, serving, volunteering, getting online and creating these these types of new areas, for meetings, for video chatting, that type of stuff. But if we do get stuck in our own mind, if we do get kind of down in the dumps, again, serve, find a way to serve. It's vital. It will be to help kind of get you in that I can change mentality, and really also just to stop focusing on one thing. We start focusing on how bad we need our fix or whatever it may be. Start looking at service, and it helps you distance yourself from that. And I promise, after so much time of doing that, it really turns into a habit. And what is such a big deal at first, 5, 10, 30 minutes later, you're like, oh my gosh, I actually forgot that that was my big problem. Now I'm enjoying this. So find ways to kind of have fun with it. But yes, reach out to others to break the isolation.
Thank you so much, Mike. This is really a topic that hasn't seen enough press during the pandemic. When 1 in 10 Americans, or roughly 22.4 million people in this country alone, struggle with chemical dependency, I am hopeful that this message will hit some of our listeners in a meaningful way and provide them tools they need to aid in this battle. In closing, do you have any books, blogs, podcasts, or websites that you recommend to providers looking to bolster our knowledge on this topic?
I thought about this, and there are many things that I like, just, different recovery books and whatnot. But if we're looking, if somebody's looking for a provider on what they can do, it's understanding your local resources, and that's going to be different for everybody. So one of the big ones that I turn people to is ICATA. Okay, well, that's a law in Indiana. I feel that they have great resources. It's a place online that you can go. And you had said it before, ICAADA, and they can go and look and get more information. But that's going to be different for everybody in their community. So as providers or people looking into this, get on your computer, start doing the Google search, start doing the work for yourself and seeing what is out there, who's doing some things, and what podcasts are out there, and start sharing them. That's something that you could share on your Facebook. It's a form of service, and you may be helping somebody else who has on your newsfeed. So get out there, start doing Google searches, and see what is in your community.
Great. You mentioned some organizations. What sorts of keywords or organizations should I put in that search box to help give me some meaningful and useful information?
Things like certified peer recovery coach, peer support, sobriety, recovery, those types of things. We want to use the right kind of positive language. So, how can I fix my drug habit? May not be a good search, even though I understand what you're saying by that. It may not be the good search, but
may not be the type of fix we're trying to help people get.
Yeah, right. Exactly. So, using things on, I had a setback, disease of addiction, peer recovery coach. Those types of things can lead you in a positive direction.
Great. Thanks again for talking to us, Mike. I really look forward to utilizing this information.
Yeah, no, I think this is definitely an area that we need to talk more about. And so if you are somebody listening to this who knows somebody in sobriety or battling with different things, I would check on them. This is not really being talked about. Honestly, I've had very few people check on me and say, hey, I know you've set yourself up and you have your normal routine, but this has changed everything. How are you doing with this? Just a simple how are you goes a long way. And so if you're listening to this, reach out to people. You don't have to make it a big deal, but just simply say, hey, how's it going? How are you doing with all of this? Is there anything I can do? If you yourself are struggling, start doing those Google searches. You can look me up on Facebook and reach out to me. I would love to send you some, once I know what community you're in, send you some resources. I also have a couple of things that I've written on my own, like a little 7 key things to do with recovery in a pandemic. So again, there's different things. Please reach out, and you do not have to do this alone.
Fabulous. Mike, would we be able to put that on the SMA site so the people listening to this could have a quick resource to grab it off of?
Absolutely. I'd love to provide that to you all. And thank you for being the people who are providing resources in many different ways to people who are struggling. So yes, any way that I could support that, I will do. And I've got some stuff to send you guys. And, again, I appreciate you doing that.
Well, great. Thank you. And thank you, all of our members and listeners out there. Please stay safe out there and keep on helping.
Thank you again for joining us. To subscribe to additional SMA podcasts, please visit sma.org/podcasts.